Hearing through an implant sounds different from the normal hearing, but it allows many people with severe hearing problems to participate fully in oral communication. Outcomes for patients with cochlear implants will vary. For many, the implant provides sound cues that help them better understand speech. Many are helped to such an extent that they can carry on a telephone conversation. Originally, only patients with profound hearing loss were deemed suitable for the procedure. One reason for this restrictive policy is that when a patient receives a cochlear implant, whatever hearing they have is destroyed. Eventually, it was discovered that patients with some residual hearing could benefit more from the procedure than those with profound hearing loss. For appropriate individuals, cochlear implants can be extremely beneficial. Each case must be examined individually to determine whether the cochlear implant is the best treatment available. Only then we should proceed with the cochlear implant. Use of cochlear implant can be controversial, especially among some deaf people. Just as spoken language helps define the culture of the hearing world, sign language helps define the culture of the deaf community. The issues surrounding the use of speech or American Sign Language by the deaf community illustrates the profound effects of language, hearing and communication on one's sense of the self. Only the sense of the self provides a human being a sort of self-control over oneself. No? Prevention of noise-induced hearing loss. NIHL, noise-induced hearing loss, is a serious health problem. It occurs on the job as well as in a non-occupational setting. And NIHL is completely preventable, yet people are not trying to prevent it. Although the consequences may vary for people who are exposed to identical levels of noise, some general conclusions can be stated. For example, sound levels of less than 75 dB are unlikely to cause permanent hearing loss, even after prolonged exposure. However, sound levels equal to or greater than 85 dB, about the same level as loud speech for 8 hours per day, will produce permanent hearing loss after many years. At this time, it is not possible to predict a given individual's degree of sensitivity to a dangerous noise. Some people may be more sensitive to noise exposures than others, and in the previous classes, we have discussed the sensitivity, the decibels associated with the vocal music, with the instrumental music, the music of the yogic sound, that is Om, then the vocal music within a whispering way, then the metallic sounds. This increase side more and more, no? And the instrumental music is starts at the level of 60, that is more closer to the upper level, whereas the vocal sound, it starts at the level 20, which is more closer to the yogic sound. So you can whisper. In a vocal music you can whisper, just like a yogic sound. That difference I have already discussed earlier. No? In the work environment, employers are obligated to protect their workers from hazardous noise. And tinnitus, I have to explain that term, tinnitus. It is a medical term for the perception of sound when no external sound is present. No external sound, yet you feel this. The disorder is characterized by ringing and roaring or repeated soft clicks in the ears. It is known that the ear continuously sends electrical impulses to the brain, even in the absence of sound. Some scientists speculate that when hair cells are damaged, the impulses are disrupted and the brain responds by generating its own sound signals. Normally, when an ear is stimulated by sound, auditory regions on both the left and right sides of the brain become active. People experiencing tinnitus show brain activation in only one side of the brain, however, unilateral. This difference in neural activity caused by external sounds, that is bilateral activation, versus tinnitus, which is unilateral activation, indicates that the disorder is likely to be a result of changes in the brain itself. Tinnitus may be produced by disturbances in auditory processing by the brain. So the difficulty in processing the auditory stimulus by the brain is the cause. Over 50 million Americans are said to experience tinnitus at some point in their lives. It's perceived as an annoying background noise. Some people are incapacitated by the loud noise that disturbs them day and night. There is some sort of damage to the ear. It may be due to some alcohol consumption or some other caffeine or some other stress conditions, inadequate circulation, allergies, medications, disease, all this can cause. And loud noise is by far the most probable cause of tinnitus. The most probable cause is the loud noise. In the modern society, we are exposed to loud noises. There is no single effective treatment. Depending on the suspected cause, individuals may be given drugs to increase blood flow, provided guidance on ways to reduce their stress, to change their diets, etc., etc. Best advice for those concerned about this disease is to limit exposure to hazardous noise. Both the proximity to the hazardous noise, the duration of the hazardous noise also. And wear some ear protection when you are exposed. And have hearing tests performed regularly. Now I have just given this thing in which certain amines and acetic acid derivatives, etc., which produce excitatory and inhibitory effect, postsynaptic effect. The location of these particular peptides and neurotransmitters, their functions, just as a tabular form, you can just note. And in this actually, I thought that I will take this class, the brain nerve cell transmission, neurotransmitters, anatomy and physiology of processing, in the next class after the year, but I have taken that first. So this last picture should have been this was the first class that I intended to take first, but I took this class I took first. So we have finished that part. Okay.